Hey, everybody, this is Jim Horn, and this is another episode of Trevor's Talk. Today, we're going to be talking with mental health advocate Kate Dahlstrom. She's going to join Trevor's Talks to expose deep concerns about the financial future of Traverse City's new Crisis and Access Center. From disappearing Medicaid funds to a vague sustainability plan, she questions who's really stepping up to fund this critical service. Kate really doesn't mince words, and neither will we. So here is Kate. Okay, Kate, we're here to discuss the crisis center over at Munson. As I mentioned in the the intro, that Kate is a mental health advocate, and she's been concerned about the crisis center over there for some time. Kate, why don't you explain? I don't think the listeners probably understand what the crisis center is over there because it's fairly new, and a lot of people might not be familiar with it. So exactly what goes on at the crisis center, et cetera?
Sure. Jim, thanks for asking. This is something we've been working on since 2021. But before that, we actually did have a small crisis center called Third Level Crisis. And that was operated by Child and Family Services. So what the crisis center is a place for anyone to go with a mental health situation that they don't have control over, a substance use disorder problem. It could be that they just want help in getting into recovery or whatever. So you define your own crisis, Jim. So you can walk in there with any of those kind of related problems or issues and get help. And starting, I think, July 9th, the center will be open 24/7. And we also have one of our NAMI, actually we have the one NAMI navigator who's there.
The NAMI is the National Alliance for Mental Illness. Is that correct?
Yes, National Alliance on Mental Illness. Thanks, Jim. And so our navigator helps people find all kinds of related services for mental health. And that could be support groups, classes. It could be facilities throughout the state or country for inpatient care, outpatient care, getting signed up with someone. It could be the court system, right? Probate court for either guardianships or court-ordered treatment. She's just really multi-talented, Jessie. And so anyway, that's why it's called Crisis and Access Center.
And that's over at the Munson facility over there, the hospital.
Across from the Munson Hospice House, it was the outpatient behavioral health, had beds for substance use disorder recovery. They shut that down, I think, in 2023.
Okay. So what's the current financial status of the crisis center?
Absolutely. And the thing that has compounded that uncertainty is the massive federal funding cuts to Medicaid, right? So we were already concerned. And because I was a co-lead on this for about a year up through getting the $5 million set aside by the county for infrastructure, I have a vested interest. And I have a vested interest in any services or facilities for people with mental health needs. Our community has expressed that as a number one concern. But anyway, I'm on the community advisory group now. I'm not a co-lead any longer, but our group is to provide advice to the leadership group of the Crisis and Access Center. And we have been asking for quite a while for specific sustainability plans. And I saw that the county was deciding on allocating their marijuana tax money, their alcohol tax money, and the opioid settlement money. And I'm being very concerned and not really knowing that we had a sustainability plan, thought it would really be appropriate if, say, $400,000 of the marijuana tax money was set aside for the Crisis and Access Center. And so they were connected. I wanted to ask for that money to be set aside annually. And I also wanted to ask to see if the county had seen themselves a sustainability plan. It's uncertain now. We don't know how much Medicaid funding is going to be cut.
Yeah, I went back and I looked at when Laura Glenn came back, she's the COO of Munson, and her comment was, don't worry. That always concerns me when somebody says, don't worry about it, especially as we have seen, as you reference, the Medicaid cuts that are coming down, and they're coming down for sure. And that's part of that new bill that's in the Senate right now. One of the things that you talked about in the article was the mismanagement at North Country Community Health, or Northern Lakes, excuse me. That led to, they're got like a $5 million plus setback, financial setback. They haven't come before the county commissioners yet. Maybe that'll come up this week on Wednesday. What happened there?
Jim, we haven't had a permanent CEO at Northern Lakes for approximately 4 years. I think we have a very competent Northern Lakes Community Mental Health Board, but the board, partly because of this Carver model of governance, wasn't getting information from the interim CEO to make good decisions. We received about $1.5 million from the federal government to do this crisis residential unit and contracted Hope Network, and then that closed in 8 months. So we basically blew through additional funding because we didn't have an experienced CEO in place who was openly collaborating with the board. I think that caused us to...
what it sounds to me like was the board didn't have a lot of the information they desired and consequently couldn't provide whatever their input was on going forward. And if you don't have the information, the board doesn't have the information that they need to provide the fiduciary responsibility, that becomes a problem.
The good news is...
No, go ahead.
The good news is that the Carver model's gone. The board is now in the process of will soon be interviewing for a new CEO, and that's all good. And the Crisis Center has a really competent director who's employed by Northern Lakes. He's been really good to work with, and he's been open to NAMI and others sharing information and feedback. And so those are some real positives. So I'm optimistic for the future. And I have to be because of all these cuts that are going to happen, right?
So,
to you, Jim.
What are the other counties surrounding Grand Traverse County? Are they helping to financially support the Crisis Center?
So our community advisory group actually had our monthly meeting Monday, and we had some folks from Munson come over we thought we were going to get a sustainability plan. We didn't really get any specific numbers, nothing like what we had originally. When we put the thing together, we had a detailed business plan that showed expected revenues and expenses. I asked that question. I said, so are we going to be asking these outlying counties who are utilizing the center to chip in perhaps some of their alcohol tax revenues, or if they have marijuana dispensaries, some of those revenues? And I got, I don't know, maybe laughed at. Are you kidding? You think they're really going to do that? And so that was very disappointing. The city, Traverse City, gets, I want to say it's at least $700,000 this last year from marijuana tax revenues. I could ask the city of Traverse City to pony up $100,000, $200,000 annually, because they and their police department, they benefit from the Crisis Center.
So Traverse City, so let me just understand that. Traverse City does not donate any money to the Crisis Center?
Not that I'm aware of, but I don't believe so, no.
Okay. So when you look at the community, you have community surveys and health assessments and so forth over the past decade. Have they provided you guys with some idea of the mental health assessments that are needed within our community?
Oh, absolutely. So every 3 years, a community health needs assessment is done. And actually, all nonprofit hospitals have to do that. So Munson has to do one. And I think other agencies look at that as well. And so since 2016, our community has said that mental health and substance use disorder treatments is their number in the top 2 concerns, and that we need more facilities, we need more therapists, and we just need more resources.
Yeah, mental health I just had a podcast with Mike Roof over at the VA, and mental health is certainly one of their concerns. Mental health within the community is a concern for everybody. Kate, What do you suggest the people do? Do the residents of the county, should they reach out to their county commissioner and talk to them about this crisis center and the sustainability of the crisis center? What's your recommendation before we end?
Yeah, I think what you just said, Jim, is good in that we should be advocating for other counties, the city, to help with this. And we should be able to get some solid numbers, right? And we should see how the operations are actually working for the crisis center. And incidentally, I was scolded by a couple of people from Munson that were at our advisory group meeting for even asking the question about sustainability. And again, it was all connected to asking for 400,000. And I apologize if anyone thought that was worried that it was going to go away. I did not intend to worry people, but I think that we all need to, because we've seen other services like the mental health beds go away and other things, we need to pay attention to this, and we need to email your commissioners and ask for a solid plan and things of that nature.
Okay.
But it's a great asset. As long as I am still breathing, I'll go and knock on individual doors for money if things get really tough, especially with these funding, the federal cuts coming. This thing, we just can't let it fail. It's so important. And this is just the start, really, Jim. We need more longer-term residential beds. This is the part of the crisis continuum, but the whole mental health recovery continuum is much broader. And in northern Michigan, and I've said this so many times, we still have 0 inpatient beds for kids. The state says we should have 16, and we have 0. And we are far low on adult inpatient beds as well. It's therapists, it's inpatient beds, it's longer-term residential beds. We need to treat mental health and substance use disorders as health, right? It's all one body, it's all interconnected, and the brain controls the body, right? So we need healthy brains. That should be our top priority.
You listen, I appreciate you coming on the podcast and talking about this. It's an important issue. It really is. It's an issue that needs to be dealt with and dealt with seriously. And obviously the crisis center and your request for the $400,000 from the marijuana money, hopefully that goes someplace. And I thank you for being on the podcast, ma'am.
You're welcome, Jim.
Take care.
You too.